A new report from the Canadian Centre for Policy Alternatives has a report out on what hospitals are spending on for-profit agencies. It reveals that there has been a 200% increase in what Northeast health facilities compensate nurses and other staff. The author of the study was in North Bay today. With more, here's CTV's Eric Taschner.
Hospital vacancies.
Andrew Longhurst paints a grave picture of the state of Ontario's staffing in northeastern Ontario.
They have been forced to fill their vacancies with the most expensive form of staffing.
Hospitals turn to staffing agencies for qualified workers who can fill shifts on a temporary basis. But agencies charge double or even triple the regular hourly rate for their staff, and hospitals want to reduce their reliance on them. The report finds that over the last decade, Ontario hospitals paid these agencies $9.2 billion.
The provincial government's underfunding of hospitals have really put hospitals between a rock and a hard spot.
The study finds that from 2013-14 to 2022-23, there was an increase from $19 million to $72 million in spending on private for-profit providers in hospitals in the Northeast.
Over that 10-year period, we've only seen a 2% increase on spending on frontline hospital staff versus a 216% increase on private for-profit providers.
While most hospitals spent around 3% of their total frontline labor costs on agency staff, including the Northeast region, by 2022-23, that had risen to 10.8%. Longhurst recommends the government begin phasing out staffing agencies over 3 years and ultimately ban them, as Quebec has set out to do. When questioned on the matter last Monday, Health Minister Sylvia Jones said the province will not stop using these agencies.
Staffing agencies are a tool used primarily in rural and northern hospitals to avoid service disruptions. In fact, it is a tool that they have been using for decades.
Jones' office adds the report inaccurately groups agency staffing costs with a broad range of purchased services, blatantly misleading the public, adding that in reality agency staff account for less than 2% of hospital hours. Ontario recently reintroduced legislation to require agencies to report billing or pay rate information. This would allow the province to publish some of those details. Longhurst also believes the government should boost hospital-based funding to the tune of $2 billion.
Their inability to increase wages and improve working conditions directly benefits these for-profit providers.
The North Bay Regional Health Centre says it has avoided the use of external staffing agencies altogether. Eric Taschner, CTV News, North Bay.